Hey everybody, welcome to the Sovereign Health Podcast. My name is Andy Schoonover, and we're on a mission to inspire radical personal responsibility for both the financial and physical aspects of your health.
Hey everybody, this is Andy. I'm the CEO of Crowd Health. I hope you are well. If you listened or watched our last video, you'll know that we're going to change it up here a little bit at the Sovereign Health Podcast. We are still going to have some awesome interviews with people who are experts in their area, but we're also going to sprinkle in some tips and tricks about how to hack the healthcare system. And if you watched that last video, you know that I was on the other side of the equation over the last couple of months. It's interesting as a business person to actually be the customer of your own service, and I was that. A few months back, I had a situation in which I was on a conference call and I was suddenly unable to speak. I called EMS, got me to the hospital, and they thought I was having a stroke. But in fact, what was happening is I had a migraine. I had about $30,000 of bills related to that ER visit, and I'm going to walk through one of those bills today to show you how I successfully negotiated it. Now, if you're a Crowd Health member, Crowd Health will help you with this. If you're not a Crowd Health member, hopefully you can, watch this and get a couple hints, tips, tricks to really reduce your healthcare costs. I started Crowd Health because about 4 years ago, I had a healthcare bill that my insurance company refused to pay because they said it was medically unnecessary. It's for ear tubes for my 1-year-old at the time. And I just paid the $8,000 directly to the hospital, not knowing that you can actually negotiate with these hospitals. Crowd Health is getting these bills down by 50 or 60% using some of the tactics that I'm going to talk about today on this bill. And I will surely, as we go through some more bills over the next couple of months, share some more. So one of the bills that I had, which was pretty interesting on how the hospital works, I had a bill for a CT scan and 2 MRIs. A CT scan was of my brain. The MRI was also of my brain, and they did an MRI of my carotid arteries. They thought I was having a stroke, and so they take a look at both brain and the carotid arteries to make sure they're not clogged up. Fortunately, as I said, they looked great, but I still have to pay the bill. Now, I got my ER bill from the hospital, and it had all of these listed on it. So they had the 3 scans listed on it. But I also got a bill from the local radiology practice. And I was like, why am I getting a bill for both? Well, oftentimes the hospital will outsource some of these services to the local providers, and in this case, radiology group. And so the hospital was billing me for the actual equipment and the technician to get that CT scan and MRI. The radiology group was charging me for the interpretation of those scans. So the hospital sends those scans over to the radiology group. The radiologist looks at it, interprets that, sends back the results to the hospital, and then the hospital delivers me the news. So what I'm going to talk about today is actually the interpretation of these bills. I'm putting up on the screen right now this bill. I'm not going to show you who the actual provider is, but I'm going to show you the actual bill. And so let me put that up on the screen right now. The bill was for $3,883. So this was the interpretation of these 3 were $3,883. From everything that I've gathered, this is probably a half an hour max of work, and they're charging me almost $4,000 for it. So I got this bill and I said, this is ridiculous. There's no way that to interpret this bill, it's going to be almost $4,000. As you can see here, it was due on 12/27. It's now January 29th as I do this. So it was a month later after I negotiated this. Just a quick tidbit here is your credit score cannot be impacted until 12 months after the service was rendered. Okay, so I was not in any hurry to do this, knowing that I have a lot of time to negotiate this. And so if you get people, collections agencies calling you and it's within that 12-month period, don't worry about it. We have another video coming up about collections, but I just wanted to stick this in there really quick. They cannot impact your credit score. All they can do is be annoying. And if the collections agency is calling you, that is basically the hospital or the provider saying, we aren't sure we're gonna get paid 100% for this, and so You're in the perfect position to negotiate with you. So this $3,883 bill was from their local radiology practice. Now, I called that radiology practice and I said, hey, if I were to get these 3 scans, and I told them what the scans were, I read them directly off of the bill, and I said, if I were to get these scans, how much would it be for me to walk into your office and get these 3 scans? And they gave me a number of $1,500. I was like, all right, already we're from almost $4,000 to $1,500. But then I asked them, I said, is this for the actual machine and the technician, or is this for the interpretation of the scans? And they said it was for both. And I said, okay, well now what you're saying is that you can provide me in the bricks and mortar location all 3 of these services for $1,500, which includes the technician, the MRI machine, the imaging machine, and the interpretation for $1,500. But when I was in the hospital, they want almost $4,000 for just the interpretation piece. So I had this information and I thought that was interesting. So what did I do? I called the billing department that was on my bill. It says, if you have any questions about this bill, call this number. So I called it and I said, here's an interesting bit of information that I found. You're trying to charge me 2.5 times for just interpretation as you would for everything. So, or for just the interpretation component, than you would if I walked in and gave me everything. That doesn't make sense to me. That is price gouging. And then here's the key line. I said, if you are going to price gouge me, I am going to take you to small claims court. Okay, so was I serious or was it a threat? Now, taking somebody to small claims court is extremely easy. I'm going to do a video here about how to take the actual process, the actual execution of taking a provider to small claims court, because it is so easy. And here's the thing, is if you try to take them to small claims court, the last thing they want to do is go to court, right? What they are going to do 99% of the time is they're going to say, fine, let's negotiate this bill, okay? So in this situation, what I did is I said, I'm going to take you to small claims court. And the first thing the woman said was, please hold. So I'm assuming what was happening behind the scenes, and please comment below if you are on the billing side of hospitals or some of these big practices. She was going to her manager and saying, listen, we've got a bill here, it's a lot, it's $4,000. This person sounds like they're willing to pay something, but is going to take us to small claims court. And came back and said, okay, sir, instead of $3,883, would you agree to pay $460? So that is an 88% reduction in that bill just by telling them you're going to take them to small claims court. 88%. And she said, you have to pay now. And I said, absolutely. I gave her my credit card. She sent me a receipt. I said, please send me a receipt. Sent me a receipt, and I will never hear from that radiology group again. So you may look at this and say, that's just not fair to the radiology group. Look, the price that I got for these was about 30 to 40% more than what Medicare pays. And so I think that's an extremely fair bill, and not to get into Medicare billing and things like that, but the way that we look at these bills is saying, hey, if these radiology groups and hospitals can make money on a Medicare patient, they should be able to make money on a patient paying 30 or 40% of Medicare. So still, 30 minutes for $460 still seems like a lot. This was an emergency situation. I needed a radiologist quickly. So it seems very, very fair to me. And I just got my bill down by 88%. So, if you want to do this legwork, and by the way, this took me all of 12 minutes. This entire set of conversations took me 12 minutes. And I was able to save $3,400-ish by spending just 12 minutes on calling some of these radiology groups. And I want to also say, like, this doesn't take a vast knowledge of the healthcare space. This just takes a little bit of research. And again, if you're uninsured, this is stuff that you can do. If you are a member of Crowd Health, this is stuff we will either do for you or help you with. And so it is very much worth the 12 minutes to go and do these things. Join us at subscribe here and just keep track of us, because we're going to give you some more tips and tricks about how to beat a healthcare system that's trying to extract as much financial value out of you as they can. So thanks for joining us. I know this was a little bit different than the past, but hopefully you'll enjoy some of the tips and tricks that we share here. Thanks so much. Go to joincrowdhealth.com if you'd like to join us.